Hello, we are into the fourth session of our discussion on medical research fundamentals, and today our discussion will be on measures of disease frequency. Starting with, we have to know which population is at risk and where we are going to conduct the study. It should be defined clearly on the basis of the demographic or environmental factors. For example, if we are doing some study on CA cervix, we have to know that the population at risk are females and those especially between 13 to 70 years. And if we are doing something on hepatitis B, we should consider the population with anti-HBC negative population. In this whole discussion, we will be looking on into certain terms which we use as measures for disease frequencies. Starting on with the term prevalence. Prevalence is something consisting of number of existing, that is including both old and new cases in the defined population at specific point of time. I think this session would be something very well known and interesting, because all of us would have gone through this in our PG preparation days or during our third year of MBBS, and so it would be helpful for people to follow it very easily. And so the formula of prevalence goes by people with disease at specific time divided by the population at risk at specified time into 10 to the power n. Here n is used. This n can be user defined because this is just a conversion to avoid the decimals in the answers. Make it as 1000, or if we are doing on some 20 lakh people, then you can make it as 10 lakh or 1 lakh, something like that. So we have to mention that in our answer, that is prevalence is this much per 1000 population, per 1000 1 lakh population, like that. So this 10 to the power n is not a constant. The user can modify it according to his or her use. So some studies use the total population as an approximate if data on population at risk is not available. So this is for the denominator. And then there are two kinds of prevalence, that is point prevalence and period prevalence. And first we'll look upon to the point prevalence. Prevalence is something that measures the frequency of a disease at given point of time. So this applies when the data has been collected at one point of time. So the formula goes by P is equal to C by N. C is the number of cases at that time T, and N is the population size at that time T. For example, 15 school children are studied today for refractive error, and 150 children are studied, and in that 15 children are found to require some glasses for vision. So the prevalence would be 15 divided by 150 into 100, that is 10%. Then we have period prevalence, that says the measures the frequency of disease over some time. So this applies when the data is collected over a period of time. So for example, from Jan 2020 to December 2020, like that. So this formula goes by C plus I divided by N. Here this I is the incident cases that develop during the period. Okay, so C is the old cases, that is the prevalent cases at the beginning of this time period, and I is the incident cases that develop during the time period, and N is the size of for 1 year. And at the beginning of the study there were 25 cases of some disease, and at the end of the study there were new 15 cases who developed during the study. So here the point prevalence at the start of the period would be C by N, that is 25 by 150, because at the start of the period there were only 25 cases, so that goes by 17%. But the period prevalence is C plus I by N, that is 25 plus the new 15 cases, so that goes by 27%. Now, what are the factors influencing the prevalence? The prevalence would be influenced by the number of the cases and the duration of the illness. And so, if there is a short disease, then the prevalence would be reduced. And if it is long disease, then the prevalence would be increased. And then what are the uses of this prevalence? This prevalence helps us to assess the healthcare needs and planning of health services, and it also helps us to measure the occurrence of conditions with gradual onset, and it helps us to study chronic diseases because there is a follow-up in this. And now we will look detailedly on what are the factors that increase the prevalence and decrease the prevalence. Those that increase the prevalence are long duration diseases, like it can be due to low cure rate or low case fatality. That on the whole, the concept should be this is a long duration disease. And then it also increased by increase in new cases, immigration of patients, and improved detection and immigration of healthy people. Immigration means coming inside, I for I. So immigration is coming inside of patients. Immigration is getting evicted, E for E. So immigration of healthy people. So in cases of immigration, that is I, and hence the prevalence will increase. And then we'll just remember one side of this, and the opposite of all these will lead to decrease in prevalence. Now we come upon to a term called as incidence. Incidence are number of new cases in a given period in a specified population. So in this, the time, that is the day or month or year, must be specified. It measures the rapidity with which the new cases are occurring in a population. It is the rapidity. For it can be expressed as absolute numbers or cumulative incidence or incidence density. The cumulative incidence is also called as the attack rate, and it is defined as number of new cases divided by the population at risk at beginning into 10 to the power of n, and it assumes that entire population is at risk and hence followed up. And we can calculate risk. That is, risk is something that is the probability that an individual will experience a health status change over a specific follow-up period, and this assumes that the individual does not have disease at the beginning and or they do not die from other causes during the follow-up, and this corresponds to the cumulative incidence. And then we have something called as the incidence density, that is number of new cases divided by the total percent time of observation into 10 to the power of n. This is also called as incidence rate, and this reflects more exactly the percent time observed. So this is called as the incidence density. And on the whole, the use of the incidence data is that it describes the trends in disease, and it also evaluates the impact of the primary prevention programs. And this diagram will be more familiar to us during our NEET PG preparation phase, and we will have to imagine a trough with a tape bringing water into, and drain which is kept at the bottom of the trough that is taking the water outside. The new water that is coming inside are the new cases, and the amount of water in the trough is the prevalence, and the new cases coming are the incidence, and the drain represents the cured patients or the dead patients. And this helps us to remember a formula, that is prevalence is equal to incidence into duration of the disease. And any change in the prevalence from one time to another is due to the changes in the incidence rate and also the disease duration, or even both. The patterns of incidence and prevalence, it is like that some diseases may have high prevalence but low incidence, that is for example diabetes, because it is a long-term disease and the prevalence would be more when compared to the incidence. And some diseases are there like low prevalence and high incidence. For example, common cold, it comes and goes in 1 week, so it is only a low prevalence and high incidence. And the term case fatality, it is the number of deaths from a disease to number of cases of that disease. It reflects how the severity of the disease is, and it is expressed as proportion ratio and not as a rate. But although its name, it is mentioned as case fatality rate, but this is not a rate and it is expressed as proportions or ratios. On the whole, summary of what we have learnt in this chapter is, in a nutshell, is that prevalence is a static measure taken at a point of time. Incidence is a dynamic measure taken over a certain time. Mortality is the calculation using population denominators to reflect the burden of the disease. And case fatality is the that which uses cases as a denominator and it reflects the severity. So that is the difference between mortality and case fatality rate. In mortality, we use population as the denominator and it reflects the burden of the disease, and as in case fatality rate, we take the number of cases as the denominator and it reflects the severity of that disease. So that's all about the measures of disease frequency, and our next session will be on descriptive study designs, and I hope you all are doing good. Stay tuned in our further sessions also. Thank you.